Let's talk a little about estrogen and progesterone. Estrogen is going to give you most of the benefits that we're looking for, but progesterone can be important as well. The big thing about progesterone is that women that have a uterus, if they take estrogen alone, that estrogen can stimulate the inside lining of the uterus called the endometrium, and if left unchecked, can increase your risk for uterine cancer. Now, if we add progesterone to the estrogen, it does the opposite actually. The progesterone counterbalances the estrogen and decreases your risk of uterine cancer over the long run. So anybody that still has their uterus, in other words, that hasn't had a hysterectomy, always gets progesterone with their estrogen. Now, the progesterone itself does have some beneficial effects, especially for sleep issues and other things as well. And so for some women, even though they've had a hysterectomy and they no longer have a uterus, still desire progesterone, and that's okay too, and we can give the progesterone with the estrogen. Estrogen and progesterone absolutely have to be in combination if you have a uterus, but adding progesterone to estrogen if you've had a hysterectomy and don't have a uterus, that's optional and really depends on your situation and what you desire. Capsules are coated with a gelatin, so the progesterone capsules and the DHEA capsules also have that gelatin. They're not vegan. All the creams and the patches are vegan products, so if that's important to you, just so you know what is and what isn't, so you can make a wise choice. The pills, the patches, and the cream all work. And so it really comes down to personal preference. How would you like to get this into your body? What's going to be most convenient for you? And price point, what's going to be affordable for you? Because let's face it, if you can't afford the medication, it's not going to work. The other thing is that consistency is very important. So you want to think about how are you going to be able to remember to take this? What's going to be the most convenient form that will allow you to take this consistently so that you can take it every day and not forget? That's going to be really important for this to work.